Okay, well, hello. My name's Jason Thompson. I'm one of the medical directors here of the Spine Center at Valley Medical Center. I'm also one of the spine surgeons at Proliance Orthopedic Associates. I've been in this practice for 12, 13 years, and I've taken a real interest in the product that you see before you. Not just the operating room, which is loud and bright and sterile, but also the full experience. And so in this short video or series of videos, we're going to try to give you some idea of what to expect when you come here to have your surgery. So if you're watching this video now, it means you're either contemplating having your surgery done through our center, or you've already scheduled it and you're here to sort of seal the deal. Either way, we want you to know what you're getting into. Because for many people, I tell people all the time, it's like jumping off the high dive. You don't know what it's like until you do it. And we do our best to prepare you for it, but until you're standing on the edge of that platform, you don't really know what it's like. So this is our best way of trying to give you an introduction. When I first came here to Valley Medical Center, surgery was being done in, I think, the very traditional way. Patients would come in not knowing what to expect at all. They'd have their surgery, they'd go to some place in the hospital, and there would be a whole collection of nurses and therapists to try to help you on your way. But now we realize that spine surgery is a very, very specialized portion of medicine. So we've developed a program where we have dedicated operating rooms. All of the staff does the same thing all of the time, so they are highly trained, both in the operating room and then the phases that follow. And this coordination of care has led to better and better and better patient outcomes. So you should know what to expect. We all know what to expect. And while every patient is individual, every patient is unique and special, having a common goal across the service line, if you will, has really elevated our care here. And it's something we believe in every step of the way. So if you look around here in the operating room, the modern operating room is almost like an industrial plant. It's not like the birth center where you go to have babies. It's all cute and fuzzy. This is hard edges. This is clean and sterile, bright lights. So when you first roll into the operating room, it's a little daunting. Yes, you may have had some medicines to take the edge off, but you're going to see people rummaging around. You're going to hear them opening things, and it can be a little bit scary. But just know that all of this stuff is here just for you. In an average spine surgery, we may have 6 different people in the operating room at a time. There'll be an anesthesiologist and a nurse anesthetist. There'll be a circulating nurse, sometimes 2. There'll be a scrub tech, there'll be a surgeon, there'll be a PA helping me, whom you'll meet in just a little bit. And then there's the product side of it, so there'll be someone representing the various companies that are our partners as we take care of patients. So it's a busy, crowded place. And then, of course, there's you. You are, as I always say, you are the star of the show. We are all here for you. And so we want you to feel that specialness and not be too scared of it. And then recognize that you are the star in each phase of your travels through the hospital. Whether it's an outpatient surgery or whether you're here 3 or 4 days, the focus is going to be on you. So as you move through the process here, you'll see that while the surgeon and the surgical team are in many ways the leaders of your care, there are so many people that are going to impact your experience here. So I just want to name them so you understand everybody has a role. And it's all intentional. These are right down to the house cleaners and the people who change out the sharps box. These are the same people day in, day out, week in, week out. So they understand what you're going through as well. So you will meet as you come through our experience here, you're going to meet pre-op staff who will talk to you even before you reach the hospital, sometimes by phone. You're going to see the preoperative nurses where it's a little bit of a hustle bustle, almost like a NASCAR pit stop. There'll be people coming at you from all directions, getting you ready for surgery. Then the nurse from the operating room will be involved. All those people I discussed a little bit earlier are going to touch you and make sure everything is perfect. And then you're going to wake up, poof, you're in the recovery room. Then you're going to be on the floor where you'll be receiving care from a whole team of nurses, nurses' aides, physical therapists, occupational therapists, and then you'll meet a discharge planner. They're going to help tie the bundle all together so you can get back home, so you can get to your life, the thing that you've been missing before the surgery. One of the most critical components of your care management while you're in the hospital from the standpoint of Pro-Alliance orthopedic surgeons are our physician assistants. My personal physician assistant that you will see and meet both before and after surgery is going to give a talk in a few minutes. His name is Josh Grant, and he's very experienced in caring for patients both in and out of the hospital. But he's a bit like the field general. He is going to make sure that all of your needs are met from the pain management standpoint, from the physical therapy coordination, from checking the wounds and the drains and all of the nitty-gritty. So I'm going to have him speak to you here in just a few minutes and give you the rundown on our take on patient care while you're in the hospital. So thank you so much for listening to this introduction to the Spine Center. I hope and trust that your experience on the Spine Center here at Valley Medical Center will be absolutely top-notch. We appreciate the time you've given and the forethought you've given to prepare, and that's as much a part of the successful experience as anything else. The next phase of this discussion, you're going to hear some of our nurses talk about exactly how the management of your experience happens here while you're on the Spine Center. So once again, thank you very much, and we know that you're going to appreciate all the efforts put in to taking good care of you.
Hi, my name is Josh Grant. I'm one of our physician assistants here at Pro-Alliance Orthopedic Associates. I work with Dr. Thompson, one of the spine surgeons, and I work with our spine patients here. And some of you may have met me already, and if not, I hope to see you soon. I wanted to explain a little bit of what I do here in my role with you as you come and have your surgery here. So a lot of you will see me both before your surgery, during your surgery, and then after in your stay in the hospital. So before the surgery, I do a lot of preoperative visits where we talk about expectations of your surgery. We talk about how to optimize you medically for surgery. We talk about the risks of surgery and how to sort of minimize those risks for you before surgery. We talk about what to expect as you come through surgery. We also talk about what to expect as you leave the hospital. We also talk a lot about how we're going to manage your medications. We talk about the medications that you currently take, what to take before and after, and the kind of medicines that you're going to be on while you're in the hospital. Once you're in the hospital, you'll see me on a daily basis. I usually come in the mornings. I'll see you before our day of surgery or our day of clinic. I'll take a look at your incision. We will do a quick examination, make sure your nerves are working, all those good things. I answer a lot of questions from the nursing staff. I answer your questions. I manage your daily medications, make any changes, and really help sort of manage the more sort of day-to-day stuff while you're in the hospital. So usually 2 or 3 weeks after surgery, you'll come back to the office, you'll see me, we'll do a quick wound check, we'll take an x-ray, we'll make sure the soft tissues are healing, we'll make sure the x-rays look good, and then we'll talk about how to progress your care from there. So I wanted to address a few of the most common questions that I get from patients. And the first and probably most common question that I get has to do with managing pain. You know, how much pain am I going to have? What are we going to do to manage this pain? So a few different things. You know, unfortunately, spine surgery isn't painless, but there are some advancements that we've made recently to help with managing your pain in the hospital. We call this multimodal pain management. And historically, what we've done in managing pain is we've given you lots and lots of narcotics, and we've found that this really isn't the best way to manage pain anymore. There's a lot of undesired side effects with narcotic pain medications like constipation and sedation and dizziness and low blood pressure, higher risks for things like falls in our elderly patients especially. So by minimizing the amount of narcotics that we give you, we really sort of minimize these adverse effects that are associated with them. So what we do now is we utilize this multimodal approach, and what that means is that we use several types of medications that act on pain at different receptor sites to utilize this multi-modality approach to managing pain. And this means using non-narcotic medications such as gabapentin or anti-inflammatory medicines or even IV Tylenol to help block pain, or even non-pharmacologic medications or techniques like physical therapy, or even simple ice packs. All these things work together to really provide you with comprehensive pain management. And we've found that this really is better for patients overall. Patients have a better experience and really less side effects, and they actually get on their feet quicker and have a better recovery. Next question I get a lot from patients is, what is my recovery going to be like? And really this sort of embodies a couple different phases. There's the portion while you're in the hospital, and then there's the portion when you get home from the hospital. So while you're in the hospital, this is really just you sort of getting back on your feet. And what I tell patients is that we really don't want you in bed all the time. We really get you mobilized early. And some patients, in fact most patients, are even up the day of their surgery. And you work with therapists, you work with your nurses, and we really manage your pain well so that you're able to do this. And most patients think, well, am I going to be bedridden, or am I going to be just kind of lying around all the time? This really isn't the case. We want you up, we want you walking around, and this actually helps speeds up your recovery. A lot of the first few days and even weeks of surgery is just simply letting those soft tissues heal, letting the incision heal, taking really good care of it, keeping it clean and dry to minimize any chance of infection, and then minimizing the real strenuous activity. Most of the real solid fixation, if you've had a fusion, is done internally. So we don't put you in a big back brace or a big neck brace and send you home. And we do want you up and walking around quite frequently, because this helps minimize any complications such as blood clots and things like that from surgery. So usually what I tell people in their recovery is mobilize early, walk often, and then really just walking for exercise, and minimize any sort of really heavy lifting. But other than that, we do encourage you to walk and stay mobile and stay active. The last thing I wanted to cover, the most common question I get all the time is about discharging home from the hospital. And this can be a scary thing. You've kind of been really taken care of, the great nursing staff, you've had people giving you your medications on time, so going home can be a very daunting experience. So the one thing I would tell patients is that really have a plan for when you go home. Talk about it before surgery, talk about it at your preoperative visit with your surgeon, with the PA that you see, and have a good support system at home, whether this is family or friends, and have a plan in place before you go home that can support you. And for most folks, like I said earlier, you're not going to be immobilized, you're not going to be bedridden, you're going to be able to do some basic things to take care of yourself, walk, prepare food and go to the bathroom and all these things that you would normally do. And you're going to have some pain and some soreness when you get home, but it's going to be very manageable. And for the vast majority of patients, they do just fine when they go home. And we do a really good job of preparing you before you go home. For those patients that may need a little extra care, the discharge planners and nurses at the hospital are very good. And those that may need a little extra time, we can coordinate a short stay at a nursing facility. But the vast majority of patients will go home without any problems. But I can tell most patients, just have a good plan going into it, and you'll be just fine.
Hello, and welcome to the Spine Seminar here at Valley Medical Center on our specialized Joint and Spine Center unit. My name is Katie. I'm one of the nurses here on our Joint and Spine Center floor, and we're excited to have you join us today. Our seminar goals here is that we want to provide you with the information you need to prepare for your spine surgery, ensure a smooth transition from the hospital to home, help achieve the maximum benefit from your spine surgery, and if you were here live, we would have an opportunity to ask questions. All right, as far as stays go, you can anticipate a one-night stay with a laminectomy or an ACDF, which is the cervical surgery that comes through the front of the neck. Anticipate a 3-night stay with a back surgery with any kind of fusion. For example, if you have surgery on Monday, you'll be ready to go home on Thursday. Our highly specialized staff is devoted to assisting you with your recovery. Many of the nurses here have worked here for decades, and they're excited to have you here in their care. Visiting hours are open. Please respect patients' need to rest. We're open 24 hours a day, but we do have quiet hours as well. If you would like to have a loved one stay with you, many of our couches turn into a bed. If that's an option you'd like to use, please just let your nurse know. Children under 18 must have adult supervision at all times, and that adult can't be you. You are the patient, and you are in no way going to be able to take care of young children. So please make sure they're here with another adult. As for long-distance phone calls, we're unable to bill them. So either bring a calling card or your cell phone. Also, we have wireless access, so laptops and tablets, go ahead and bring those if you'd like. And please note that we are a smoke-free campus. If you are a smoker and you think this may be a problem during your stay, we do ask that you talk to your physician about options to help you with nicotine cravings. All right, preparing for surgery. Once your surgery has been scheduled, a pre-op nurse is going to call you and get some personal information. That nurse will interview by phone or in person and gather pertinent medical information for your hospital stay. You may be asked to see your primary care provider for surgical clearance. You may be asked to have some lab tests, chest x-ray, and an EKG performed before surgery. The goal is that we want you to be as healthy as possible for surgery. The surgeon's medical assistant will contact you with the day and time of your scheduled surgery. Please stop all anti-inflammatories. That means aspirin, Aleve, Advil, any other kind of herbal products 5 to 14 days prior to surgery. If you have any questions at all, please call the surgical staff. Leave all of your valuables at home. You may be given a special body wash the night before your surgery, and please use fresh sheets the night before the surgery. So the idea would be is that you take a shower using the special body wash and then get into fresh, clean sheets. That goes along with using a fresh towel to dry off after your surgery, and please don't use a communal bar of soap. Pack your personal care items: a robe, comfortable loose clothing, footwear that is steady and sturdy, and any prescribed medications in the original bottle. That way we can verify the dosage if there is any question. It's also helpful if you write down your medications and when you take them and the dosage so that we know exactly what you're taking and can make sure that you're getting those medications while you're here. You are responsible for your belongings, so once again, please leave your valuables at home. The hospital will provide you with all of your prescription medication during your stay. Many people ask us about their annual flu shot, and I would ask you to refer to your surgeon as to if it's okay to get your flu shot around the time of your surgery. I do know as for your pneumonia shot, we ask that you do that 3 weeks before or 3 weeks after your surgery. Prepare your home for safety. Take a look around. Do you have any throw rugs or loose cords? Those are considered tripping hazards. Sometimes after surgery, you're not as steady. You may be using a walker. You may be using a cane. You don't want anything that could trip you up and cause you to fall and re-injure your surgical site. Make sure you have a portable phone available to you that can be sitting next to you at all times, and remove clutter. Evaluate your home. Do you have stairs to enter your home? Do you have stairs to go upstairs to your bedroom? Another thing that a lot of people forget is they think, oh, I have stairs to my front door, but they forget that they have stairs into their garage. It may be just 2 stairs, it may be 5, 6, 7. Also take note, do your stairs have a handrail? That's important to help you with your mobility. Day of surgery, please come to the hospital fasting. We ask you that you don't eat anything 8 hours prior to your surgery. If your surgery is scheduled for 8 a.m., then we ask you to stop eating at midnight. You may take any medication as instructed by your physician with a sip of water. It's very important to take note of your heart medications, blood pressure medications, diabetic agents such as metformin. Typically, we tell you to hold your metformin prior to surgery. Please consult your physician prior to your surgery and discuss the medications you are currently taking. They'll let you know which medications to hold and which medications to take. Any doubt, please ask your doctor and even mention it to your pre-op nurse prior to surgery. All right, day of surgery, when you get here, we have various parking options. The first is valet. It's right outside the front door. It costs $2. It's for all day. It's open from 5 a.m. to 5 p.m. If your loved one's car here is still here after 5 p.m., don't worry. You don't have to go get the car out of valet. You'll just go to a separate area to get your keys. It's a security desk that we have downstairs. We do accept cash or credit cards. We ask cash no larger than $20. I mentioned that it's 5 a.m. to 5 p.m. Parking options also, we have a garage right here in our tower. We're here on the 5th floor in the Valley Medical Center tower. Down below us, there is a parking garage. You'll get a ticket when you come in the door, and you'll need to get it validated before you go out. It is of no cost to you, and if you have a loved one who decides to bring you in for your surgery, let's say at 7 in the morning, and decides to spend the night with you, it's fine to leave your car there for 24 hours or more or longer. All right, when you get there, you can check in at Surgery Admitting. It's in the main lobby to the left of the fountain. You can't miss it. Our main lobby has a beautiful giant fountain in there. You just move to your left and you'll see the Surgery Admitting desk. When you check in, you'll receive a pager that you can give your family. During surgery, family and friends should wait in the 3rd floor lobby, which is right near that same fountain. When the surgery is finished, your surgeon will page you and come out and meet your family. While your family waits, they can track the status of your surgery on a couple of these screens that we have over by the admitting desk. The way that you can track your surgery is you'll be listed there by the first 3 letters of your last name, a comma, and the first letter of your first name. Your family can track your status as you move through the pre-op area, into the operating room, and into the PACU. After hours, if there are any problems, your family can use a phone. It's over by the pharmacy to call for assistance. In the pre-op area, what to expect. Your surgeon will mark your surgery site. An IV will be started and pre-op antibiotics will be administered. Pre-op pain medications will be given and your pre-op history will be reviewed. You'll be moved into the operating room. Please note the operating room is cool, bright, and quite noisy. You'll be wearing an air temperature controlled gown, so fortunately you'll be warm. I think it's typically called a bear hugger and it feels wonderful. The anesthesiologist will administer the appropriate anesthesia and the operating room team will position you for your surgery. After you are asleep, a catheter may be inserted into your bladder. In the OR, your team includes your surgeon, a surgical assistant, an anesthesiologist, a nurse anesthetist, OR nurse, and surgical technicians. You'll have lots of people looking over you and taking care of you to make sure that your surgery is successful. After surgery, you'll be moved into the post-anesthesia care unit, or PACU. After surgery, you'll be taken in there for your recovery. A PACU nurse will be assigned to you and care for you as your anesthesia wears off. When you wake up, you should expect to have your IV, possibly a drainage tube that will be coming from your surgical site, oxygen, and typically when you first come in, it'll be in the form of an oxygen mask, and typically it is changed then to a nasal cannula once you are breathing a little better on your own, and a catheter. Your anesthesia wears off, you may experience some pain. Please don't be alarmed, this is normal, you just had a major surgery. The PACU nurses are well trained in caring for people who are experiencing issues with pain, nausea, headaches, etc. You may also have some issues with blurry vision, dry mouth, and nausea, like I mentioned earlier. Please don't be alarmed. This is all normal, and the staff is trained to help alleviate your symptoms. After PACU, your anesthesiologist will decide when you're ready to be moved up here to our Joint and Spine Center on the 5th floor at Valley Medical Center. Generally, it's 1 to 3 hours after your surgery. So you'll come out of the operating room, you'll go into our PACU. It's usually about 1 to 3 hours depending on your symptoms and how you're doing before you come up here to the floor. For example, if your surgery was scheduled at 7:30 in the morning, you'll probably be up here in your room by 11 a.m. When you are ready to transfer, you will move up here to 5 South on our Joint and Spine Center. And there's a picture of our lobby and waiting area. Your family is welcome to wait in that area after they've talked to the surgeon, or they're also welcome to come up here and our staff will show them to your room where they can wait comfortably there for you as well. All right, pain management. This is a big issue for a lot of patients. Typically, the first 24 hours are the worst. we really try to ask you to identify your pain as how it feels. Is it a spasm? Is it an ache? Is it a sharp, throbbing pain? Are you having nerve pain? These things are important because we have different medications that can help alleviate different types of symptoms associated with pain. We have muscle relaxants, narcotics, and nerve pain medication. Tylenol is used around the clock. And if you experience pain, you need to make your nurse aware of what your pain level is. This is our pain scale. You'll probably get tired of having us ask you what your pain is, but we always like our patient to rate their pain from 0 to 10. You have had a major surgery, and while I wish that we could always keep you at 0, it's really not a reality. As a nurse, I always try and tell my patients that if I can try and keep you in this area here, then I feel like I'm doing my job. I never, ever want to see you up here in this area. Which is another reason why it's important to talk to your pre-op doctor or talk to your surgeon prior to having your surgery about any narcotics or pain medications you're taking. They may ask you to try and wean back so that we can have successful pain management post-op. All right, managing possible risks. Infection. You'll be given a dose of antibiotics in the operating room, and then once you're up here on the floor, you'll get antibiotics as well. Blood clots. Key to managing blood clots is early mobilization, and we use something called SCDs, or sequential compression devices. They're placed on your legs and they squeeze them. They kind of give them a little massage. Pneumonia, a key to avoiding that is early mobilization, deep breathing, and sitting up in a chair for meals. Another thing that we have is we have something called an incentive spirometer. It's just a little device that we have you inhale and you watch the little ball rise up, and the goal is to inflate your lungs to avoid having a risk of pneumonia. Also, constipation is a big one. We will be asking you to drink lots of fluids. You'll be having IV fluids, typically running for about 24 hours after your surgery. And then on top of that, we have a bowel program here where we have a variation of different bowel medications we'll give you to avoid having constipation. All right, rehab. This is one of the key pieces to your recovery. Activity promotes recovery, and you will be up and walking, aka ambulating, the day of your surgery. All right, the day of your surgery or the morning after, if you come in late in the evening, a physical therapist will come in and see you. They will evaluate your need for physical therapy. You may be seen by both a physical therapist and an occupational therapist twice a day, depending on your need for therapy. The therapist will determine whether you need home equipment, and if you do, they will provide you with a list of places where you can either buy or rent some of this equipment. Range of motion after surgery is typically only limited by pain, which is why it's a key component that you let us know if you're hurting and that we can keep you properly medicated so you can work with our physical and occupational team. All right, incision care. Your incision may be closed with either dissolvable sutures with a long, clear tail. These don't require removal, but will be clipped at your follow-up appointment. Steri strips, which are usually placed over the top of the wound and kind of look like an opaque tape, will be allowed to fall off on their own. And typically, you're allowed to shower the second day after surgery. If for some reason your doctor uses staples, they will be removed at your post-op appointment 14 days after surgery. All right, going home. Plans for going home should begin before you come to the hospital. You need to have someone pick you up from the hospital. You can't drive yourself home, and please note that you cannot drive while you're taking narcotics. You will need assistance from a family or friend for the first week you are home. You will need transportation to your first follow-up visit, and you're going to need to make sure you organize your bills, financial obligation, pets, and child care prior to surgery. You're going to be in no shape to care for anyone but yourself. Going home, the nursing staff will make sure that you understand what pain medications you're going home with, when to take them, and how to take them. A bowel management program, and then we're going to provide you a printout with the list of all of your regular medications, and we'll let you know when you can begin taking them again. We do have an opportunity to fill your pharmacies here at Valley Medical Center. Fill your prescriptions here at Valley Medical Center. We have a pharmacy right downstairs. It's very convenient. We can just send your prescriptions down, and your loved one can pick them up prior to picking you up. So we make sure that we have all your medications for a successful transition home. Please note though, if you do usually have any copay, bring something so that you can handle that. Equipment for home. You may need to pick up medical equipment recommended by physical therapy or occupational therapy for successful recovery. You may need a walker or a cane. These are examples here. If you don't know where to find them yourself, our PT and OT staff can provide you with a list of where to get these. Do's and don'ts at home. Do walk daily as much as possible. This helps with your recovery. Take your prescriptions only as directed. Call the office if you develop suspicious drainage from your incision. And wear elastic pants to your follow-up appointment because x-rays may need to be obtained and can't be done with any sort of metal snaps or buttons. Do not use a hot tub or bath for 6 weeks, and that goes along with swimming. We don't want that wound to be submerged and therefore open to bacteria, which then can cause infection. Do not apply lotions or ointments to your incision. Don't cut or remove sutures or steri-strips. As we mentioned before, steri-strips typically fall off on their own 7 to 10 days after your surgery. You can shower with steri-strips on and just leave them alone. And once they start to fall off, it will be clear as day and that your incision is healed. Don't be frustrated if your process is slower than you expect. Everyone is different. Don't be concerned about migrating pain. Don't use previously used towels. Please use fresh towels only. And don't use that communal bar of soap again. Have a bar of soap or body wash dedicated just to you. Thank you for attending our spine seminar. We look forward to seeing you here on the 5th floor of Valley Medical Center, our Joint and Spine Center, and wish you a successful surgery and recovery.
Hi, I'm Melissa Graves, the manager of the Joint and Spine Center. I want to thank you for watching the seminar today, and I want to let you know that we're dedicated to providing you with quality, excellent care the entire duration of your stay here at UW Valley Medical Center. Thank you.